firing. Now, we perceive patterns in these behaviors. So the importance of today's topic, which I'm going to share with you, is looking at this whole range of behaviors from young until old. So the first thing I'd like to share with you is regarding innovations in crime prevention in Malaysia. It used to be a long time ago where we took ideas, theories from Western and use it in Malaysia. But we find that sometimes it doesn't really fit into our society, it doesn't fit into our norms. So this is what we did. Okay? This is what we do in crime prevention, the various areas, psychology, criminology, sociology, all of that mixed together. We look into assessment. Areas of assessment, what can we do? What can we do with the children who have conflict with the law? Psychometrics is a very key component in understanding people's behaviors, their attitudes, their perceptions, and their emotions as well. Followed by court matters. So as a criminologist, we come into the picture doing intervention after crime occurs. Now this is delayed reaction. This is after the event has occurred. Now we want to focus on crime prevention. We are trying to do it in a way that we think we have to do something before the crime actually occurs. We don't want it to be whereby crime has occurred and we come into the picture. So it's crime prevention. We want to be active. We don't want to be someone who's reactive to the crime. So this is something different. Followed by victimization. We know that there are many victims of crime, yet the legislation, the focus is more on criminals. Children especially are traumatized by crime. Like that, they are scarred for life. Yet not much effort has been done to care for them all the way to adulthood. They'll get the perpetrator of a crime, bring the criminal, get the bad guy, bring it to court. The child is also brought to court sometimes to testify. Once that happens, I'm sorry, the prisoner, of course, he's in prison, but then what happens to the job? The recall, the trauma, the relationship. So we want to be in a situation whereby we can help people before crime occurs. This is followed by criminal profiling, a very important element, because crimes are getting more and more serious in today's world. Finally, crime prevention. Okay, followed after the application of these areas, we move on to the next area of concern for criminology and crime prevention. What are the innovations that we find? The first important thing is that we need to assess the criminals and the victims using the psychometrics tools that we have. We have changed them into the Malaysian context, not only in terms of language, but also into the norms. This is important because we cannot be using theories from other places, for example, America, UK, German perhaps, or even Japan, into our context. We have different values. We have different ways of working. Now, this is the FARA crime index in reducing crime in Malaysia. Is it actually working? Surveys indicate that it actually is. However, the way that media portrays crime seems to depict that crime is worsening. This is actually true. Now, the answer to this is that the degree of criminality is, but the number of perpetrators aren't. A small number of crimes are actually committed by the same people again and again. They commit crimes again and again. So it seems as if crime is becoming more and more. But actually, in fact, it isn't. It's just getting more and more serious. We used to hear people snatch theft, for example, or just robbery. Now it's snatch theft plus murder. Robbery plus murder. So the degree of seriousness is increasing. Not actually how many incidents are occurring. Now we see here, fear of crime index 2.8 is actually a reduction from 2009. And looking at the right at the end, you see that the global peace index actually states that Malaysia, May 2011, is actually among the safest places to live in. Malaysia is safe. Okay? It's just sometimes that the perception what's brought into the media, newspapers, create more fear than actually warrants the reality. Okay? topics, what we cover in criminology, crime prevention. What are the innovations that we are doing now? First, children conflict the law, Child Act 2001. Okay, next. So we look into the family system. We don't look into uni-model or uni-dimensional. We look at multi-model. We look at various areas of concern where criminologists come into the picture. We have psychologists, sociologists, social workers, lawyers. All of them play integral parts in making Malaysia safer. So crime prevention is a holistic viewpoint. We look at factors in the family level. Is it masculine family? Is it feminine? Then we look into communication channels. Is there proper communication? We look at relationships with individuals in the family. We look into the psychology of the family. Is it nuclear? Is it bigger? Is it small? Extended family members. Then we look into the norms of that family. All these show that we cannot just apply one theory. We cannot apply just one approach. We cannot even apply just from Western or just Eastern. It must be Asian context. Followed by community norms, perception. How does the community look at crime? How does it look at violence, domestic violence, for example? Attitude, behaviors, what are the values, what are the practices in the community? Are they tolerant or non-violence? Followed by environmental influences, status, values, learning, and practices. Next slide, please. These are examples of children conflict with the law by actual 16-year-old children, so you can see for yourself. Is this a victim or a potential criminal? Next slide. This is a girl. She seems to be stepping on crime, but you can see she doesn't have one foot. So she's a dependent type of personality. She can't stand on her own. Her hands are too short for her body. Next slide. She looks to be nice, decent, wearing her hair up. But let's just say, I'm smoking. So the projecting someone good, but actually inside, not that good. These are at risk children. We do the intervention before they actually do the crime. Next slide. What about this? Shows only one eye. Only one eye and one hand. No feet. Hand behind the back. That is the clear symptom of keeping secrets. When anyone draws here, hand behind the back, careful. For those who plan to marry, I would suggest you find your future husband or wife, ask them to draw. They draw with one hand behind the back, say goodbye, find someone else. Dangerous. Okay, next slide. What was this? 16-year-old boy as well. Potential criminal in the making. So we have to do the intervention. That's our role as criminologists. Okay, next slide. Special topic, crime of passion. Okay, let's look at it. This is the typical crime of passion you get, where you have a husband, wife, and the individual. Next slide, please. In actuality, let's please press enter. Press enter. It comes like this. 64 combinations of crime of passion. Next slide. Okay, criminal profiling. This is a very important element. Criminology, innovations that we look at one aspect, we look at multiple aspects of the crime itself. Next slide. This is a typical methodology used for criminals to get into the prison system. So, at the time we have created the crime rehabilitation model for sexual offenders in Malaysia. Since 2007, all those who graduated from this program have not been offended. We're talking about 1,000 sexual offenders every single year. Now it's 2012. 6,000 sexual offenders have not raped anyone since they got out of prison. Based on this model. It's something good. Okay? We're moving them, looking at patterns. We're not looking at only one aspect of person's behavior. Next slide. This is another topic I'd like to share with you. It's about taking care of people who are in the bottom million. In relation to the crime, is that many people will say crime is a poverty thing. It's a poverty issue. Same thing goes for this. Okay? Next slide. Okay, this is the story of Hong Kong again. Patient of stroke, difficulty moving around, mobility. The music needs to be loud. or difficult it is for the lady to get to the car. She just has a stroke. Trying to find parking at the hospital. Difficulty in finding a car park because no school in the hospital. That's difficult. So we face this among many people of the society. Finally, coming with this, difficulty in getting out of the car. So we're reaching out to people, recognizing factors that they feel, that they experience, and doing something about it. Have become a victim of crime, a trauma, stroke, becoming a victim from slash or robbery. Or seeing the victim of murder next door, your neighbor. So one of the effects are suffering this. Okay. After registry, what happens next? Line of people to get to the doctor. Okay, the poor lady is so sad. Okay? Next slide looks into the teamwork. These are the team members involved, one translator and 9 members. Next slide. And these are the people of the team affiliation group from the health sciences. We have 10 individuals from different programs. Next slide. This is a problem that we find. Difficulties in getting optimized about treatment for stroke. So what happens that they want to validate whether it's true? This is a problem that they face. Next slide. Okay, what are the difficulty is going to the hospital to get treatment. Next slide. Okay, followed by who are involved, the patient, or you see the caregiver, and the therapist, because there's just so few of them in the country. Sometimes the waiting list is just too long. Next slide. When does the problem occur after hospital discharge? How long do you stay in hospital after being diagnosed with stroke? Is 3 to 1 week. 3 days to 1 week you stay in hospital, then you discharge. After that you have to go back to the hospital for treatment. That takes a long time, sometimes up to 1 year. Next slide. Okay, where does the problem occur? In clinics, in hospitals, in centers where they offer treatment for stroke rehabilitation. Next slide. Okay, why does it happen? It's basically because when you see burden, they need family members to come and bring them to the hospital. Next slide. How does this happen? Because the location of the houses in rural areas are just too far from the places that they need to go. Sometimes there's traffic jam, sometimes the flooded, sometimes the roads are not very good, so they face difficulty. Okay, limited mobility and time required. Next slide. The problem statement, difficulty for stroke survivors to get the needed help that they need. Next slide. Okay, primary benefits are as follows. Mainly is that to reduce the financial burden and they get the help they need. Next slide. Consequences is that delayed rehabilitation, delayed mobility. There's a lot of problems associated with the complications because of stroke. Next slide. Okay, limited mobility, 31. But half of the respondents out of 60 agree that they had problems in mobility. Next slide. Logistics burden, 39, more than half. Next slide. Okay. This is the chart where we did for our module. 50% increase, optimization, reduce development costs. Next slide. Achievement rates, we actually achieved that 57% increase people who get help, 91% reduce in cost, 56.3% reduce in operational costs, and 93% reduce the lack of treatment needed. Next slide. Okay, this is the first innovation, followed by the next. These are the stages involved in the module. In the CD, you can find it. Next slide. This is the technique that we use to create the slides, to create the module, to create the booklet in various languages. Next slide. So we came up with this. We have several languages. Now it's been translated into 15 languages. And the first time we did it, we offered it free. Now it's like hotcakes, because everyone wants a piece of it. Next slide. Okay, marketing potential. This is where we can produce it, help out people, multi-million. Next slide. Marketing potential across the world. Please press enter. Okay, next slide. Cost saving is mentioned from 2,400 before and offers 200 ringgit. Okay, 91% reduction. Next slide. From 288 hours required, it goes down to 18 hours. It's 94%. Next slide. From 96 hours for treatment time, it goes down to 6 hours. Next slide. Reduction of 105,000 ringgit to 59,000 ringgit. Next slide. Okay, so it's copyrighted by USM. Next slide. This is the primary benefit. You have the CD. It's now 60 ringgit plus the booklet. Next slide. And this is the patient testimony.
Mana Geshina kena stroke ini selama hampir dekat 2 tahun. Dengan ini saya berpuas hati dengan modul ini. Saya tak perlu pergi ke USM kerana saya buat saya di rumah sendiri. Saya boleh solat, boleh mandi, boleh sendiri berjalan dengan baik sendiri. Kalau saya pergi ke USM, saya tak ada masa dan masalah proses saya payah. Oleh itu, saya usaha juga lah buat saya di rumah dengan berpuas hati atas diri saya ini.
So, in conclusion, next slide. This is what we do with the model. So, many people can benefit, not only the patient, but also family members. So that's what we have.